In this next situation, Dr. A and Dr. B both rendered services to the same patient the same day and both subsequently billed for their respective services. One was an actual office visit, later in the day, a telehealth video visit. Can the services be combined and uploaded? The asker says that their biller says that they can absorb one of the services into the other and possibly bill for a 99214, 99215.
The general rule of thumb and the CPT rule is that you're only going to get one E&M visit per day, per group, per provider type, that kind of thing. So if somebody saw someone in the morning and then somebody saw someone else later in the afternoon in the same group, it's going to get, if both those claims went out, it would get denied. Same provider, same day, same specialty. The first one that gets there gets paid, the second one doesn't. What you pretty much need to do is to add them together like this person said and file one claim. A couple of things come up in here. Number one, physicians are, over the past few years, even more cognizant of their own RVU production and what did I do today and what does it look like to the administrator or the group leadership. They need to put their points up on the board. What did they do? So Dr. B may not really be so interested in just saying, oh yeah, take whatever I did and just you report it under your name and you take the money, and the RVUs. That's good. If it all comes out in the wash and everybody kind of agrees that, this happens to me as often as it happens to you, maybe that's not a problem. But kind of the other issue in here is, these were two different visit types. Was one of them an office visit and the other one was it a phone call or was it a video?
Telehealth video visit.
Okay, so that would have, in the current public health emergency, that would qualify for use with those office visit codes. So now you're kind of tracking to do the two of the same codes again, which you don't want to do. So this brings up even more, how do you add it together questions? Do you take the totality of the history exam and decision making and sort of glue them together? And you could do that. But the documentation is not really going to look like that unless somebody has some kind of foreknowledge here. The second person would have to be kind of aware that you had this first visit and kind of build their note around that. They would maybe refer to the earlier, physical exam or whatnot, and maybe refer to some of the decision-making elements that happened before, and they would have to kind of package it. What a payer isn't really going to be interested in doing is taking this apple and this orange, from over there, 213 and a 213, and adding them together and magically coming up with a 214. That's not really going to work. Probably the best way to do it would be for the second person to talk about time, total time in both encounters. But again, the first person doesn't know that there's going to be a second visit, so they may or may not say anything about time. We might not know how long that is. It's just an awkward set of circumstances, and each one of those would have to be kind of handled the way that you could handle it. But sometimes when you try to kind of retrofit documentation into some code structure that you want to put out there, it's kind of not a good fit. It just doesn't look right because people weren't thinking that way when they wrote those notes. So, yes, you can probably maybe get a higher level of service out of that, but there's probably going to have to be an addendum somewhere along the line, and one of the docs is going to have to give a little ground, So it's doesn't have a perfectly clean answer, but those are the considerations.